Andy, thanks for joining us.
Thank you, Tom. Thanks for having me.
It's been a great day to honor the Oculeve team, and you were an integral part of that. You were COO of Oculeve at the time of the acquisition by Allergan, and you've been a member of the Allergan family for, you were just saying, close to 2 years now, right?
That's right. It's been wonderful.
So just take us back a bit. When did you join Oculeve, and sort of how did the wild ride with Allergan begin?
Yeah, I mean, how much time do we have here? Well, really, I think it's been a great run. I was introduced to Michael early on. I was actually quite comfortable in Santa Barbara running an IOL company that was sold to Santen Pharmaceuticals. So I was enjoying the sunshine and met my wife there and met with Michael and Jim. Jim Loudon was the CTO at Oculeve. And both of them had this really unique idea of implanting and stimulating the lacrimal gland. No one had thought of that. And I thought it was really goofy when I first met them. It's like, you're going to do what now?
Yeah.
And so it was very different. But they had all the key players involved and the strategics in terms of the great minds like Bill Link and others. And we were very fortunate to have even a very need-finding approach for this. The whole biodesign, I'm sure Michael's gone over this before, is all about the patient, the unmet need.
Sure.
So that was really wonderful. I love the way the culture was. So there were 4 or 5 of them before, and there was a leap of faith for me, without a doubt. And we had to move to San Francisco with my wife. But I made that leap of faith, and it worked out well.
I guess so. I think what people enjoy about the story is it's sort of a bit of nostalgia, where these 4, I don't want to say nobodies, but these 4 people who hadn't had experience in startups before, start a company, create a device that helps people, and sees a successful end. What do you enjoy? You were at Santen before this. Had you done startups before? Is this something that you enjoy doing and intend on doing again?
True. I mean, it's very addictive, right?
Yeah.
It's a cliche of, it's just very addictive, the fast-paced environment, the rush that you get out of it, the ability to pivot quickly, that's also equally important. The previous company that I was with was not a startup. It was more of an early-stage asset in intraocular lenses that was spun out to Bausch & Lomb. It was the Envista IOL. There was also, Santen now has the rights to the material, all the rest of the world as well. So, but that's a lot different than a very early-stage idea that came out of a postdoc at Stanford. So I think Michael and Jim did a fantastic job in pursuing and moving quickly and getting a lot of right folks on board. So to answer your question, I mean, it is addictive. Once you do it, you're definitely looking at what else can I be involved in to create a lot of value and disrupt the conventional care.
Well, how do you view areas of interest for you? Do you obviously you were in a lens company. You did dry eye. Is ophthalmology where you want to spend your time, and do you see an enormous amount of opportunity for innovation within ophthalmology?
I mean, eye care is unique, and I think personally I would love to thank you and the OIS team for putting on a great show. You guys have created a great ecosystem for all the stakeholders to meet and work together. So I think we've been very fortunate.
It's our pleasure. Yeah, no, it's a great specialty, but but it's because it does bring us to people like you. So is this an area where you want to do something else? Do you think you've got another one of these in you?
Oh, clearly, I think I'm looking at. I'm very excited. Time will tell.
Yeah.
But in terms of eye care, I've been in eye care for over a decade now, and I've been very fortunate to build some great relationships across the board. So I really enjoy ophthalmology as an ecosystem to work in. There's still a lot of unmet need in ophthalmology, and things move quickly in ophthalmology. There's a great amount of momentum that you don't necessarily see in other fields. So we're definitely looking at assets within eye care, and love to find one that I can run with.
That's great. And going back to Oculeve, the storybook beginning is great, but I think also the ending, the acquisition, the way Allergan sort of left you to your own devices. That's what Brent Saunders said, that they sort of said, just continue to be Oculeve. If you need our help, we're here. Is that how it played out?
And that's exactly how it played out. In fact, I think it's exceeded both Michael and my expectation in how it's played out. I think Allergan's been a fantastic partner. This award, the OIS Innovator Award, is really representative of all of Allergan as well that's been involved in this program. And it's been, like I said, 22 months or so, not that I'm counting, but it's been a great journey. We've built some great friendship and bridges with the Allergan team members who've been very critical to the success of this program.
And final question, where were you when you received word, I guess it would have been a week and a day ago, that the FDA approval finally came through?
So I still remember that. It's the 24th of this month, this past month rather, and that was at a team meeting. And suddenly I'm checking my email, and I can't believe my eyes. So it's just I had to double check it, triple check it to make sure that was the case. It was obviously a very proud moment for all of us.
And who does that email come from?
That came from one of our consultants
I see.
who was representing us on this behalf.
And they get the letter first and they let you know?
That's
Is
right.
that how it
They
happened?
sent an email blast to some of the key folks. Michael was one of them who learned about it too. He was in another meeting too, so he heard about it. He starts running around, really delighted. So it's been a long journey for us, but I'm happy it's a great place now.
Great. Well, it's a great story. We're happy to tell it, and we're happy you're part of it and part of OIS.
Thank you, Tom. Thanks for having me.